Hi everyone. Today I wanted to show you something that came up in clinic, that often comes up in clinic, and this is the difficulty balanced patients have with rotational movement. And Mo at our clinic showed you before the dynamic neurological stabilization progressions, where you start off lying down and you start doing very simple movements that kind of take you through the developmental stages of going from lying down to sitting upright and standing up that infants go through. And so there's one part there that people kind of struggle with, and that's the part where they get up onto their knees like this. And so the reason why we're showing you this is because if we can train your somatosensory system to be a bit more grounded, that is a better foundation for all movement going forward. Rotational movement is so important because everything we do is rotational. Whether it's swinging a bat or running or walking or those type of things, reaching for something. So what happens here is when you get to this point where you're kind of kneeling, a lot of people start feeling quite dizzy and so on. And so we kind of show them how they can increase their stability by rotating a bit and leaning into increasing the force they feel on their foot and kind of leaning into that side. So you're kind of adding to that rotational type movement. And so when they want to stand up like that, they also find it similarly difficult because it's hard for them to kind of recruit that rotational type movement. So what we do is to give them that feedback, we get a little stick like this and get them to hold it right there. And they have to kind of push into it and stay stable in the face of a force kind of being applied here. So I'm going to get Mo, my friend Mo here, to come show me. So Mo's going to push like that. And so, you know, if I don't want to fall, I'm going to have to kind of load my hip. And now I'm quite stable. And then when I want to push him, all I got to do is use my whole hip. So he's pushing, and I'm dropping my hip. Dropping my hip. You can push hard and see how powerful this movement is? It comes from a place of stability into power. Loading the hips, it kind of comes out and back a bit, and then forward. Loading the hips, add that rotational movement, coming forward. And when you come up, so you don't feel so bounced, you're going forward, and this will help guide you. Hope that was helpful.